Hello viewers, I am Dr. Shashant. I am a clinical andrologist at 49 Hospitals, Secunderabad. So today I am going to explain to you a little bit about DNA fragmentation test and for whom it needs to be done. So the first thing is, what is sperm DNA fragmentation index? So why is it important? I will answer the queries. So sperm DNA fragmentation index is an index that will give us an idea of the percentage of the sperms that are having a healthy DNA. So actually, if you see the structure of a sperm cell, in the head of the sperm there is the nucleus, and in the nucleus there is a lot of DNA, the chromatin information, which is deeply condensed. So if there are some damages in this DNA strands or any breaks, so what can happen is there can be an improper genetic information, and it can lead to repeated pregnancy failures. It can lead to unexplained infertility, where even if the semen test has come as normal, which means that if the sperm counts, the sperm movement, that is the sperm motility, is also normal. The sperm morphology, which is the shape of the sperm, is also above 4%, which is normal. In such cases also, if the couple is experiencing infertility and if all the wife evaluation is normal, so in unexplained infertility, this is a good test to be advised, because this can sometimes reveal a high percentage of fragmented DNA in the sperms. So what is the common cause of DNA damage? The first common cause is varicocele. So what is a varicocele? It is an abnormal dilatation of some blood supply, blood vessels near the testes, which are the veins. So if this happens, it can lead to heat, and increased temperature in the scrotum can result in testicular damage by something called as free oxygen radicals, free radical induced damage. So this condition is actually correctable, reversible condition. So before this testis is damaged, we have to identify this condition and we have to do the surgery for varicocele, which is called varicocelectomy. So all cases are not indicated for surgery, only cases above grade 2 varicocele. After the surgery also, you will have to wait for a period of 10 weeks in order to repeat your semen analysis and to see any benefits in the sperm counts and sperm parameters. Secondly, one more important cause of increased DNA fragmentation is substance abuse, alcohol, smoking, marijuana use, and other infections that can cause increased DNA fragmentation, such as some viral infections like mumps or tuberculosis. Then there are some chronic medical conditions, patients who are suffering from uncontrolled diabetes, hypertension, sometimes due to some endocrine dysfunctions. They are also cases that can have increased DNA fragmentation. So in which conditions, in which couples do we advise DNA fragmentation? First is couples who are suffering from unexplained infertility. Second is couples who have had repeated failures in attempting the pregnancy by IUI or by IVF. But if there are a couple who has been facing repeated failures in intrauterine insemination technique, particularly those above 3 cycles of IUI, we can advise them to go for a DNA fragmentation index. And repeated IVF failures, in spite of the embryo being average or good quality, in those situations also we can advise for a DNA fragmentation test. Men who are above the age of 40 years, because aging also decreases the quality of the sperm, it can increase the fragmentation of the DNA in men with higher age group. So in also situations where there have been repeated pregnancy loss in the form of a miscarriage, So in those cases also, we advise DNA fragmentation index. Repeated abortions, the pregnancy is suddenly the heartbeat stops around 7 to 8 weeks. So, or it can result in some spontaneous abortion because the chromosomal information is incorrect in the pregnancy. So, what happens here is if the sperm DNA is fragmented, even in IVF process, there will be poor fertilization rate. You will not be able to get a good quality, good grading of the embryo. Or if the embryo is fine, what happens is sometimes the embryo does not implant in the uterus. It can have implantation failure. And if it implants, sometimes there is a higher chances of a miscarriage, and if there is no miscarriage, sometimes there are higher chances of some genetic syndromes occurring in the baby. So these need to be screened for. And how to decrease DNA fragmentation, I will get to that. But first, how much is a high DNA fragmentation? So any DNA fragmentation that is less than 15% is normal. So we analyze the DNA fragmentation by some tests, which are the SCSA, that is the sperm chromatin structure assay, and there is another test called the SCD. Then there are some other tests which check directly the quantity of the sperm DNA damage, which is known as the tunnel test or the comet assay. So using these tests, we will be able to identify the percentage of sperms that are having the DNA damage. So if there are more than 25% of sperms that are having a DNA fragmentation, that is a significant report. It means that there is a slightly decreased chance for the pregnancy rates. So in cases of high DNA fragmentation, what we advise is increase the frequency of ejaculation. So more number of ejaculations either by masturbation or increasing the sexual activity frequency. So that fresh sperms are repeatedly created in the testis, and if there is a very long period of abstinence, that can also cause DNA damage or dead sperms also. Therefore, by increasing the frequency of ejaculation, we can help to decrease the DNA fragmentation by as much as 25%. Then we sometimes use tablets such as antioxidants, vitamin C, vitamin D, zinc, folic acid, selenium, levocarnitin. So these are around 5-6 elements that we prescribe to our patients. At least they should be used for a period of 2 to 3 months to see some benefit. So these antioxidants will help to reverse the oxidative stress induced damage, and this can help in improving the quality of the sperms as well as decrease the DNA fragmentation. Then in some cases where the DNA fragmentation is more than 50%, in very high DNA fragmentation cases, we can do directly remove the sperms from the testis, because most of the DNA fragmentation occurs in the reproductive tract from the epididymis or sometimes in the accessory glands. So we can decrease the DNA fragmentation by obtaining the sperm directly from the testis via surgical sperm retrieval. So in these methods, we can help to decrease the DNA fragmentation and improve the pregnancy success rates. If you have any further doubts regarding this topic, you can comment in the comment section below, and you can have a consultation with me if you are suffering from male infertility at 49 Monday to Saturday. I am available, and please make use of this andrology new facility at 49. Thank you.